This is Amanda Bitter doing my assessment for Nursing 210, my Student Health Assessment video number 1. Hello, my name is Amanda, and I'll be doing your assessment today. Today we'll be covering your head, your face, and your neck. Do you have any questions before we begin?
No.
Okay, so I'll start by looking at your skin. The skin on your arms is consistent with the color of your race. It is consistent throughout. There are no lesions noted, no blotching, and bruise noted, but otherwise healthy and intact. The temperature of your skin is warm throughout. Testing the turgor of your skin, I don't see, your skin retracts within 3 seconds. I don't see any signs of dehydration or tenting. Looking at your fingernails show no signs of clubbing or spooning. Capillary refill in your fingertips is less than 3 seconds. There is no, the skin nail is adhered to nail bed. Well, no early detachment of your skin, of your nails. The texture of your skin is dry, no conditions or no signs of pallor or diaphoresis today. I'm going to move on to your legs. Just going to raise your hands up here. Sorry, thank you. Again, condition of your legs is consistent with the upper extremities into your race. Your legs are warm and dry. There are no signs of edema on either leg. There are no varicosities showing, no lesions. Let's see, on your toes, capillary refill again is noted in less than 3 seconds. Skin turgor shows immediate retraction, no signs of dehydration or prolonged tenting. And again, no varicosities are seen. Temperature again is warm and consistent with the upper extremities. I will now move on to your head. Looking at your face is symmetrical. Your eyes are bilaterally even. Ears, the helix of your ears extends above your eyes and reaches the side of your eyebrows. Condition of your scalp, if you could look down, thank you. Scalp is clean. Hair pattern throughout shows coverage of hair throughout. No signs of thinning, hair, baldness, lesions on the skin, or infestations. Okay, thank you. Let's see. Wait, can you remove your glasses? Thank you. Palpation of the face. Any tenderness?
Nope.
Okay, no tenderness noted. Paranasal sinuses, palpation. Any tenderness there?
Nope.
Okay, no signs of infection. Again, the eyes are symmetrical. The nose is midline on the face. Lips are seen as dry. No cracking or fissures noted. Ulcerations there are no ulcerations as well. Skin is even toned throughout. There is some pustules noted along the cheeks, but otherwise no lesions. Ears, external ears are bilateral as well. I'm going to examine your eyes. Oh, excuse me. Before I do that, I'd like to test your cranial nerves. Your cranial nerve number 7, your facial nerve. If you could please smile for me and frown. Puff out your cheeks, purse your lips, and show your teeth. Good. And if you could please close your eyes and try and open them against my resistance. Perfect. Great. I would like to test your sensation, testing cranial nerve number 7, your trigeminal nerve. 5. Cranial nerve number 5, your trigeminal nerve. If you could please, when I ask you, close your eyes and identify whether you feel sharp, which feels like this. Can you feel that?
Mm-hmm.
And this is soft, okay? Close your eyes. Okay. What do you feel now?
Soft.
Okay.
Soft.
Great. Yeah.
Sharp.
Okay.
Soft.
Great. 2 more times, okay?
Sharp.
Great. And last time.
Soft.
Great. Very good. Sensation is noted throughout the face. Now I'm going to move on to your eyes. I would test cranial nerve number 1 by having you do a Snellen test, where you would stand a distance of 20 feet away, cover your eyes. I note you wear glasses. You can put your glasses back on, by the way. Thank you. I've noted you wear glasses, so I would have you first uncorrected read the Snellen chart from top to bottom as low as you can, and then I would have you remove your glasses and do the same. I would also have you do the Rosenbaum test, which tests cranial nerve number 1 as well. It tests nearsighted vision. I would have you read a card 14 inches away from top to bottom as low as you can, and noting when you stop. Okay. We will defer that today. As far as your eyes go, your eyes are bilaterally symmetrical. The iris is noted as blue in both eyes. Pupils are equal and consensual. Would you remove your glasses again? I'm sorry. Conjunctiva is pink and well desiccated. The eyebrows are even, consistent with the color of the hair. They're coarse. Let's see. The eyebrows extend beyond the outer canthus of the eye. Any pain when I palpate your eyes?
No.
Okay. Lacrimal sac is non-tender, and there is no signs of infection or swelling. I would like to do a couple tests on your eyes. First thing I will do is I will have you follow my pen light here, only with your eyes. I'm going to test cranial nerve number 3, number 4, and number 6, your abducens, your trochlear, and your ocular motor. Okay? So if you could please just follow my pen light only with your eyes. Great. No signs of nystagmus or ptosis noted upon that. Now please focus off into the distance. Okay, and when I ask you, focus on my pen light. Keep looking off into the distance, and now shift your focus. Okay, good. And last thing I need you to do is watch my pen as it comes in. All the way in, and keep watching. Good. Pupils are reactive to convergence and accommodation. If you could please remove your eyeglasses again, I'm sorry. Okay, cover your left eye, please. Okay. Good. Okay, and now this one. Good. And pupils are equally round and reactive to light as well. I'm now going to be doing a light test. You can just stare off into the distance, okay? Light test. The light is noted the same in both eyes. There is a twinkle in the center of both pupils. I'll now use my ophthalmoscope and test the inside of your eye as well, okay? So just look off into the distance, okay? The sclera is noted as white. The lens is clear. There is a red reflex noted in the retina. Good. Macula is noted as a darker area. There is the fovea centralis in the center, which is noted as a light whitish color. The retina is noted as yellow in the back, and the optic disc is a lighter orange yellowish circle with smooth edges. Again, in this eye, the retina is noted as a yellowish, is well vesiccated. There is the fovea centralis as a white dot in the center of the macula. The optic disc is noted as well as a yellow-orange circle with smooth edges. Great. I'll let you blink and get your eyesight back. Next thing I need to do is do an uncover and cover test. So if you could please cover your right eye, just like this, and now look off to your left and uncover. Sorry, continuing to look. So cover, look off, and then continue to look that way and uncover. Great. Both eyes move bilaterally and equally to the left. There was something I'm missing. need to do your peripheral vision test. So if you could, with your pen light, cover your right eye again, and tell me when you see my pen light, okay?
Yep. Yep.
Okay, great. See it. Okay, now cover your other eye. See it. Okay. See it. Great. See it. Wonderful. Okay, good. Your eyes are great. We have tested cranial nerve number 1, number 2, the optic nerve there. I will now move on to testing your ears. Ears are bilateral. The covering is consistent with the color of your skin. Does it any pain when I palpate your tragus here? No. No tenderness noted upon palpation of the ears. Have you any pain when I palpate the outer portion of your ear?
No.
Oracle is pain-free. The external portion of the ear is noted with no lesions or leaking or redness. Excuse me. And now I'm going to do an internal ear exam. It may be uncomfortable, but it shouldn't be painful, okay? Okay. Inner ear canal is noted with mild hair and a mild amount of cerumen. The tympanic membrane is visible. It is a pearly opal color. It is flat with the cone of light visible at 5 o'clock. Okay. And bilaterally we will do this, okay? Sorry. Okay, again, mild cerumen is noted in the ear. Small hairs covering the internal canal. The tympanic membrane is visible. Again, a pearly gray color with the cone of light shining at 7 o'clock. Great. Any tenderness when I did that? No. Okay. I'll now take this moment to scan the room and show there are no notes or open books. Okay. We're going to do a hearing test now. I'm going to do a whisper test. I just ask you to cover the opposite ear and repeat that to me in the ear I speak into what I say, okay? Okay. So go ahead and cover your left ear. Okay. Purple. Okay, and cover the opposite ear. Green. Excellent. Very good. Now we're going to be doing a test called the Weber test and the Rhine test. This is going to be testing your cranial nerve number 8, your auditory or acoustic nerve. Okay, what I'm going to do is I'm going to strike this, I'm going to place on your head, ask if you hear me bilaterally as well or more so in one ear or the other, okay? Okay. Okay. Nothing?
I can hear it in both.
Thank you. Okay. Didn't hit it hard enough, I'm sorry. Okay, now I'm going to place this behind your ear. You tell me when you can stop hearing it by indicating now, okay? Okay. No. And again, when you can stop hearing it. No. Great. I'm going to do the same in the other ear. Ooh. No. Okay.
No.
Excellent. So your ears, bone conduction is normal, that it would be shorter than air conduction. Air conduction is usually longer in a 2-to-1 ratio, which is what you have indicated today, so that's wonderful. We're going to move on to your nose. The nose is noted as midline on the face. The nerves are symmetrical. No lesions noted on the top of the nose. The skin covering is consistent with the rest of the body. What? Oh, here it is. Excuse me. I'm just going to look into your nose, okay? Okay. There is small hairs noted. No foreign objects. It is moist, inferior, turbinate, and the. Can you look back, please? And look up towards the. Perfect. Great. Okay, turbinates are visible, well vesicated, is pink. Okay, I'm going to have you include one nostril and breathe in, please. Great, and repeat the same on the other side. Good. It was a little difficult on one side more than the other, yes?
Yeah.
Okay, you have a cold? Okay, no problem. Otherwise, any issues smelling?
No.
Okay, I'm going to test your cranial nerve number 1, your olfactory nerve, by having you close your eyes, and I'll have you smell with one nostril and then include the next and smell without one, okay? Okay. Okay. Please close your eyes and include your left nostril. Okay. Tell me what you smell.
Cement.
Beautiful. And now close your eyes and include your other nostril and tell me what you smell.
Coffee.
Yes. Very good. Okay. Last thing I'm going to do is your mouth. Nope, second to last thing I'm going to do is your mouth. Inspecting the lips, again, they are symmetrical. They are dry. No signs of cracking or fissures. No ulcerations noted on the side. I'm going to put some gloves on. Sorry. Great. Okay. I'm going to, if you could open your mouth. Okay. Good. No ulcerations noted on the inside of the mouth. The mouth is moist. It is pink. I'm going to feel your hard palate, okay? Palate is hard, and it moves into the soft palate. There's just tongue depressor. Actually, I'm going to use this one. Small mouth. I'm going to count your teeth. Okay, 27 teeth are noted. Okay, if you could open your mouth again and put your tongue down. Good. Can you go ah? Ah. Good, good. Uvula is visualized. It is midline. The gums, again, the gums are pink. No signs of inflammation or tenderness. Any pain that might palpate your gums?
No.
Great. Good. No visible caries or cavities are noted in your mouth. That is great. Again, sorry. Lift your tongue up. Up. Great. Frenulum is noted under the nose. You can relax. And under your lips here, and frenulum is noted on your bottom lip. Not done. Sorry. Let's see. Moving your tongue aside, your Wharton's and Stenson's ducts are also visible. Okay. Mm-hmm. Great. I would test cranial nerves, your glossopharyngeal cranial nerve number 9, and your vagus nerve by noting that your speech is appropriate and your swallowing is appropriate, and I will be deferring your gag reflex today, but that is also how I would test that nerve, okay? Okay, last thing I'm going to do is inspect your neck. Okay? Neck is midline and is symmetrical on both sides. Shoulders are symmetrical on both sides. The coloring of the skin, again, is consistent with the rest of the body. It is warm. I'm going to palpate your nose here, your postauricular, your occipital, your preauricular, submandible. Any pain when I'm palpating? No. Okay. Deep chains and cervical chains. And can you shrug your shoulders? Good. Any pain there? Mm-hmm. Okay. No pain noted or signs of infection noted on your lymph nodes. Palpating your trachea. Sorry, this is a little uncomfortable. Trachea is midline. Any pain? Nope. I know it's probably uncomfortable. Trachea is midline, no tenderness or swelling indicated there. Please shrug against my shoulders or my resistance. Good. Any pain? Nope. Okay. And turn your head towards my hand. And again. Beautiful. Okay. That was testing cranial nerve number 11, your spinal accessory nerve. You did great. I just need to palpate your trachea. This might be a little uncomfortable, okay? Palpating your trachea. Good. No signs of inflammation noted. Good. Any tenderness there?
Nope.
Just going to be listening to your trachea. I'm sorry, your carotid arteries. Good. Carotid arteries are palpable. No bulging noted in the carotid arteries or the jugular veins. No distension is noted. Okay, auscultation of the carotid arteries. No bruits are heard. Heart rate is audible. Now I'm going to listen to your thyroid gland, which is what I was palpating earlier. I think I said trachea, but it was your thyroid. Okay. Could you swallow, please? And if you could, please hold your breath. Great. Okay, great. Thank you. No bruits are heard. That's all I have for you today. Thank you.